Hey class. So I recently did my field work to rotation at Cleveland Clinic in Port St. Lucie. The facility specialized in more of a neuro acute care, treating patients with conditions such as strokes, spinal cord injuries, Parkinson's, and a bunch of other conditions. Throughout my time, I encountered various challenges and different things in my day to day work as an occupational therapy student. One in particular that stood out to me in my experience that I would like to share was talking about the patient refusals. So I had a lot of patients that I would go see and I was scheduled to see. Typically, I would see about 8 to 10 patients a day. Um, However, when I would go throughout my day, I would have various of reasons of why a patient would refuse therapy treatment, such as fatigue, pain, or simply just feeling overwhelmed with their current medical situation. As a result, my planned treatment sessions were often like kind of interrupted or disrupted, and this in theory kind of created a challenge of the meeting my caseload and meeting my units for the day and providing consistent care. Cleveland Clinic has a few policies in place to address patient refusals. The standard approach was really just to document the refusals, provide education to the patients about the importance of therapy, and reschedule the therapy sessions another time when it was possible. In cases where refusals were frequent, I would document, of course, all of the attempted um, attempts for the evaluations or the treatment plans. When it came to about two or three refusals, I would also talk to the nurses, incorporate the doctors, things like that to get everybody else on board and make everybody else more aware of the fact that this patient is refusing therapy. Many patients continue to feel overwhelmed with their condition and treatment, so it really does make them reluctant to engage in therapy. If I had the opportunity to address the issue differently, I would probably focus on implementing more of a patient centered approach from the start. Essentially, just using a little bit more therapeutic self to connect with patients, to encourage them more and building more rapport to engage in therapy. So, this could involve spending more time during the initial evaluations to thoroughly assess the patient's emotional and mental state along with their physical condition. I think understanding their fears and concerns and goals more deeply will help us build trust with our patients and make therapy feel less of a task and more less of a task and more a part of their recovery journey. I would also probably like to advocate for maybe like a short informal check-in with the patients that we've done evaluations on or treatment sessions on throughout the day to encourage the patient with like maybe a non-clinical manner. This might help maybe essentially build the rapport and reduce refusal. Maybe this might engage clients and feel more comfortable with therapy versus just kind of being repulsive towards it. And it's like not as much as it's not seen as like a medical task or a necessity. It's more of like a way to connect, a way to bond, and to be a part of their rehabilitative stay. Um, in conclusion, or in general, I was really surprised to see how often and how frequent patients were refusing during my fieldwork experience, but it did make me realize the importance of not only treating the patient's physical condition, but also understanding the emotional and psychological barriers that can impact their recovery. This experience has taught me the value of really approaching patients with a holistic approach to their care, and that's something I will carry with me as I move forward in my occupational therapy career. So, thank you for listening to my reflection on this issue, and I hope this sheds light on the importance of addressing patient refusals in a thoughtful and empathetic manner.